The following program is a production of Naleo TV.
Aloha and welcome to another episode of COVID-19 Talk Story on Naleo TV. I'm Micah Alameda. It's the fourth day of February 2021. And if you can remember, back on January 30, 2020, the World Health Organization declared the outbreak of COVID-19 a public health emergency of international concern, just over 1 year ago. Since then, this pandemic has crushed families and communities throughout our island state. Here in the U.S., we're approaching 27 million positive cases, an average of 145,000 new cases per day. The amount of deaths in our country as of yesterday was just over 446,000. Just over 446,000. This is frightening, and I really hope we can get back to some type of normalcy in the near future. I'm here to tell you we won't beat COVID-19 on hope alone. We have a strategy, and key elements of that strategy is washing your hands, wearing a mask, physical distancing, ordering takeout, and even enjoying the Super Bowl from home. We'll take a quick break. When we get back, we'll be joined by State Rep Gregigan. Don't go anywhere. We'll be right back.
Times are different, but our mission remains the same. While maintaining social distancing and following proper sanitary protocols, Naleo o Hawaii still seeks to facilitate and promote community engagement through media. We're staying safe so we can continue to serve you.
As you know, with the start of a new year begins a new legislative session, where elected leaders at our state capitol will battle it out to try to tackle the toughest challenges of our time, like the economic recovery to COVID-19. And joining us now is State Representative Gregigan, who represents House District 4 in the Hawaii State House of Representatives. Rep, how are you?
Good. It's good to see you, Micah. It's been a long time.
It's been
I've
a long time.
always wanted to be on your show.
Absolutely. Thank you so much. I know you're busy, so let's jump right into it. To give us some context, with the session just beginning, you're the Vice Chair for Transportation. You're also on the House Finance Committee. What are some of your top priorities?
Well, as you know, Puna has a lot of things that needs to get done, and Puna is always my top priority. There are some issues, particularly in broadband, that I want to focus because the coronavirus pandemic has made it apparent that there's a digital divide. And so I want to really push broadband initiatives. And the first thing that I actually was working on was at the Makuu Farmers Market, the homestead there. They needed access. So I talked to the providers, and there are two providers, Spectrum and Hawaiian Telcom. Hawaiian Telcom actually worked with me with DHHL, and we got broadband connectivity at the Makuu homestead. So that was the first win. Now in transportation, we're trying to spread more broadband throughout the state infrastructure, and hopefully we could get more broadband throughout Puna and in the rural areas.
You know, I think you hit it right on the head. Broadband connectivity for Puna must be brutal. You know, it's such a rural district. It's huge. It really encompasses so much geographically. As you know, the rest of the state, correct, can fit in the district of Puna if you were just to line it all up, which is astonishing. What are some other things that you're focusing on, Rep. Gregigan?
Well, thank you for asking, Micah. I'm actually really passionate on making sure that the Youth Challenge Academy program stays alive. We're talking about promising youth that needs our help. And the program provides discipline as well as structure and gives them that teamwork ability. And when they graduate from this program, they get an equivalent to a GED. So we're helping these kids start off in the right foot. And as you know, with the pandemic happening, there's a $1.4 billion shortfall. So DOD has to cut but one of the programs they're cutting is actually the Youth Challenge Academy. And I want to make sure in in the finance committee that I'm in, as well as working with Representative Chris Todd, we really want to make sure that we restore funding for the Youth Challenge Academy.
Now, Rep, you are a member of House Committee on Finance, and you just mentioned the $1.4 billion shortfall. Now, you being on this committee, you have this bird's eye view from this top level. What are some other ways that you see, or maybe just are being discussed about, for us to make up for this $1 billion shortfall?
Well, as you know, the Finance Committee, we're going through the budget and we're trying to make sure that we fill that gap. And I'm really excited working with our Finance Chair, Sylvia Luke, and as well as the members in Finance. We recently had our info briefing, so we went through 18 departments and got to hear what their needs are and what they're cutting. Soon later into the session, we're going deep, really dive into how we can fill those gaps. But at this moment, I don't have those clear solutions to share with you. But maybe later, if I have another opportunity to talk to you, I might be able to share more.
Thank you, Rep. You know, I understand that it's still very early on in the session. Committee hearings haven't even really, begun. It's just getting started. So just thank you for sharing whatever you could. Before I let you go, I know that earlier this week you were able to catch up with Governor David Ige. I think that's very efficient for your district, the fact that you are even getting FaceTime with the governor. How was your conversation? Was it effective?
It sure was, Micah. I really wanted to make sure that the rural areas have access to broadband. And I'm so glad that Governor Ige, especially at his speech at the State of State, and he mentioned that rural areas like Puna will have better access to broadband. And I was discussing that with him and making sure that I talk to the necessary departments that's going to really push that. So I'm helping making sure that we have that broadband access. And the governor is definitely supportive of having more broadband in rural areas.
Well, you know what, Rep? I think that's it's very optimistic to see someone who's in their first term in the legislature already getting solid FaceTime with the CEO of the state. Lobbying for not just your district, but for Hawaii Island. So thank you so much. Before I let you go, any final words?
Well, Micah, I got to say that all levels of government, whether it's the administration, even the county, even the federal, when we all work together, we better serve our community. So if anyone out there would like to reach out to me or contact me, you can reach out to our social platforms like Instagram and Facebook at Rep Iligan. And you can also contact me by email at repiligan@capital.hawaii.gov. So thank you, Micah, for allowing me to share on some of my priorities. And man, it's good to see you again.
Thank you so much, State Representative Gregor Iligan. He represents the 4th District in the House of Representatives. Have a safe week. Aloha.
All right, man. Take care.
Thank you. If you're thinking about getting tested, you absolutely should. Here are opportunities in the next few days to get tested. We'll be right back. Joining me now is one of the individuals that are on the direct front line of not just fighting this coronavirus pandemic here in Hawaii Island, but really serving the County of Hawaii, and that is Cyrus Jonathan, the Public Information Officer for the County of Hawaii. Cyrus, I know you're a busy man. Thank you for joining me.
Hey, how's it going, Micah? I have no problem at all. Happy to join you at any time.
Thank you so much. You know, I'd be remiss if I didn't ask you, how is Mayor Mitch doing?
You know, Mayor Roth is doing great, actually. I just spoke with him this morning. He's in very good spirits. He's very optimistic that he'll be back very, very soon. But, you know, we're really just wanting to make sure that we are allowing him the full time to recover, that we're not rushing him back, and that, you know, he gets the clearance he needs from his doctors before returning to work. Just like any employee, he needs a doctor's note to come back after missing more than a week.
Well,
so
that's
until
fantastic.
he can get that, we're not letting him back.
That's very good to hear. Cyrus, as you know, the State Department of Health has already administered well over 150,000 vaccinations statewide. Can you give us an update of any kind on vaccinations and testing here on Hawaii Island?
Yeah, absolutely. So interestingly enough, I think we weren't expecting the level of vaccine interest from our folks, especially the kupuna 75 years and older. We knew there would be definitely a strong interest, but we had no idea how many folks would be reaching out, be wanting to register, et cetera. And so right now we have basically almost a backlog of registration that goes almost 2 to 3 weeks back. Initially, we had planned for phase 1B to sort of take, you know, anywhere between 2 to 3 weeks. Now it's looking like it could be anywhere from 3 to 6 weeks. And that's just because our kupuna are really interested in getting the vaccine, returning to normalcy, and making sure that they have the health protections they need in order to thrive through this pandemic and be able to you know, not worry as much, because a lot of our kupuna are very worried right now. So
now, Cyrus, we know that as you just mentioned, a lot of our kupuna are wanting to get vaccinated. Do you have any numbers, or where can they find information?
yeah, absolutely. You know, the best way to go about getting information is connecting to our website, and that's www.hawaiicounty.gov/vaccination. On that site, you'll find all of the major hubs, the 3 major hospitals on Hawaii Island, which is Kona Community Hospital, North Hawaii Community Hospital, and Hilo Medical Center. There they have all of their information, the call lines that you can use to call in, as well as online registration forms right from our site. You know, the one thing, though, I will say about our kupuna is that, you know, we're putting ads out in the newspaper and we're advertising our site, but we as a county don't have a call line yet. So what I would suggest is that if you know a kupuna or have a kupuna that is in need or interested in getting the vaccine, that you help them. If you're a younger generation, you have a computer or a smartphone or a tablet, it would really be helpful for you to reach out to Malamalos Kupuna to help them do the registration process, especially if it needs they need an email in order to register, and just provide that for them so that, you know, you can take away that humbug and you can really make it an easy process and a smooth transition for them to get their vaccine and keep them protected in times of COVID.
Now, Cyrus, your boots on the ground, you are directly working on the forefront with this pandemic. Would you say, from what you see out in the community, would you say that our island residents and even our visitors, the very few that we do have, would you say that they are heeding their precautions? They are wearing their mask, they are social distancing, they're trying not to gather, staying home as much as you can. Would you say that our island is complying?
You know, I think when we think about those numbers, that we really have to look at how well we're doing. And our island as a whole is doing great. One of the best in the nation for keeping our COVID numbers down. We have to believe that that's because folks are following directions. They're socially distancing, they're washing their hands, you know, they're wearing their masks out in public. And especially the visitors that are coming in. You know, we're fortunate enough to have a post-travel test for trans-Pacific travel, meaning that those tourists and those visitors who do come, that travel across the continent to get here are getting tested twice. So that's the first level of security that we have. And then after that, you know, I think it's very obvious that our local community, our residents, they're wearing their masks, they're using the hand sanitizer when they get in the store, they're standing as far apart as possible. And I think our visitors are receptive to that. And because of that, I have to believe that those are the reasons that we're doing so well and that our community is really following and listening. And we just want to mahalo everyone out there for following the rules and for being attentive to each other and taking care of each other in this time.
You know, Cyrus, thank you so much. It really is a kako thing, right? This is going to be an effort on behalf of all of our residents, our visitors, anyone who comes to our island needs to subscribe to fighting this pandemic in order for us to get through this. Thank you so much for your time. I really appreciate it. Any final words before I let you go?
Yeah, I think it's at the end of the day, we just want to mahalo everybody for being very patient. In this time when vaccines are limited and the amounts that are coming to our islands from the mainland and really all around the country, just understand that we do anticipate enough vaccines for everybody eventually. In the meantime, we would like to thank you folks for just, remaining calm, remaining patient, waiting your turn, and allowing those most vulnerable to get vaccinated first. Also, we do want to thank everyone for getting vaccinated in place. We realize that some hospitals on the west side or the east side or even the north side might have more vaccines than others nearest you. But it's very important that you allow those communities to receive the vaccines from the healthcare provider in their community. If you don't, it'll cause a lot of problems logistically for a lot of these healthcare providers who are planning for the amount of folks in their neighborhoods. And so we just want to thank everybody for that understanding. And with that, just want to say aloha from Hawaii County. Mahalo.
Right on. Cyrus Jonathan, Public Information Officer for the County of Hawaii. Thank you, my friend. Take care. Be safe.
Hello, Micah.
Don't go anywhere. We'll be back right after this.
It was just a dead stop.
It's the first time that I haven't worked since I was 15 years old.
Open up, close again, open up, close again.
We are done. Our restaurant is closed due to Corona.
I've had to move back in with my parents.
To get back to real life, I'm pretty much willing to do anything.
To be that selfish and still be like, okay, we're just gonna party and nothing matters. It's a bummer.
We have to do it if we want these tiers to just open up more.
The more we work together, the quicker we can get out of this.
Joining me now is our weekly expert, Peter Schwartz, Senior Vice President for Strategic Planning and Chief Futures Officer at Salesforce. Peter, how are you?
Great. Good to be with you, Micah.
Thank you so much. With everything that's going on and the state of affairs where we are currently with the pandemic, I think it would be very efficient if you could go through for us everything we need to know about vaccines.
Great, thanks. I want to begin with a question. And the question is for our audience. Do any of you have polio or know anybody who's had polio or measles or mumps or rubella or anybody who's had hepatitis? You probably don't because we all got vaccinated for it. All those diseases are mostly gone now from our childhood and adult. Nobody has smallpox anymore. I have a smallpox vaccine little scar on my shoulder I got when I was a kid in the elimination of smallpox. I went to the local Catholic school and got a polio vaccine when I was a child. It's gone. Vaccines work. We have in a world that is so much better because of vaccines. There are so many children who are alive today that would have died, frankly, from the various childhood diseases, everything from polio and even measles, which was fatal for many children, all eliminated by vaccines. So right now, we have the opportunity to help eliminate COVID-19 on this island. Now, we've done very well so far, but we have to vaccinate. And unfortunately, some people are being somewhat resistant to taking the vaccine. And I want to talk to you people in particular, because it's not only just about you. Right? The vaccine protects you, but it helps protect everybody else as well. The more of us that get vaccinated, the less disease will be spreading in our community, the quicker we get to herd immunity. So the vaccine is not just for you, it's for everybody else as well. It's for your family, your friends, your community. So it's very important because we need to get to about 75% of the people on this island who have either been infected or have had the vaccine. Now, fortunately for us on this island, we've done very well in preventing infections. Literally only a couple thousand on the island. What that means is that we have to achieve herd immunity through vaccination. rather than getting sick, right? I mean, it's obvious. Much better to get vaccinated than to get sick. And that's how you develop your immunity, right? So better strategy, get the vaccine, don't get sick. Now, the truth is that this vaccine is really safe. This is science that has been now around for several decades, called messenger RNA. It's like DNA, but it's called RNA. And it's extremely safe with a minimal amount of side effects. Almost nobody experiences very much second shot. Some people get a little bit kind of flu-like. The old vaccines, and ones that we use, for example, traditionally for the annual flu vaccine, were based on killed virus, that they used a little bit of the virus itself, and that's how they developed the immunity. This vaccine has no virus in it. There is no risk whatsoever of getting the virus from the vaccine. And so this is essentially no risk. Now, it's not hard to understand why people would have a bit of a hesitation. This is new technology. This came along quickly. But what you need to know is that there was no kind of shortcuts taken. This was fully tested in all the ways that normal drugs are tested, and it is seen as extremely safe. So we need to take the vaccine. Now, let me be clear, that still means for quite some time we need to practice all the things that we usually do: wash our hands, wear face masks, socially distance. Remember, we've done amazingly well on this island. That's how we've kept it open and safe. We're one of the safest places in America because of what all of you people have done. So that's what we need to keep doing. We need to make sure we can keep the island safe and keep the island open by wearing masks, washing hands, keeping distance, and take the vaccine.
You know, Peter, before I let you go, I have to ask you, we have one of the largest unofficial American holidays upon us, and that's Super Bowl 55 coming up this week, Sunday. Do you have any advice for any of our viewers who are planning to watch the game and gather? Any advice for those viewers?
Very good question. The truth is, this is another one of those opportunities for super spreading. So let's be clear. If you're going to hang out with your friends, better yet, if you could even do it outdoors. You know, I have my TV set up where I can sit out on the terrace. Better yet, don't have a big gathering. Keep it under 6. Keep the air flowing, and so on. And better yet, keep it in your bubble. So this is an opportunity to avoid spreading.
Thank you so much, Peter Schwartz. We appreciate it. Our weekly expert. He's the Senior Vice President for Strategic Planning and Chief Futures Officer at Salesforce. If you have a question for him or you'd like him to touch on a topic, please consider emailing us at askpeter@naleo.tv. Peter, have a safe week. Thank you so much. Welcome back. As you know, one of the largest unofficial American holidays are upon us, and that is Super Bowl 55, coming to you this week, Sunday, February 7, from Tampa Bay, Florida. And joining us to talk more about Super Bowl 55 and how we can celebrate this huge, momentous weekend safely is J.E. Orozco, our sports guru here at Naleo TV. Now, J.E., tell us, with positive cases in America over 26 million right now, and with us surpassing the 440,000 mark of deaths caused by COVID-19 currently right now in our country, tell our viewers, tell the residents of our island how we can celebrate this weekend that we hold dear to our heart safely.
Now, again, you mentioned those are some pretty grim statistics, but on the positive side of things, things are starting to turn around. And this, you mentioned it, it's like a big holiday. It's like Thanksgiving. It's like Christmas. It's like New Year's, because a lot of people traditionally get together. This is the one year where we're saying, maybe not so. Wait till next year to have some even better memories than you're going to have this year. That being said, I mean, we should give kudos where they should go, and that is the NFL. Managed to keep a whole season together from start to finish. Here we are at the Super Bowl. Wow. They do have their own problems with COVID, and if there's anybody that's really putting a hammer down to it, it is the NFL. In fact, over this past week, on Sunday, 2 players from Kansas City, Daniel Kilgore and Demarcus Robinson, the center and wide receiver respectively, got their hair cut. Sunday, that person who cut their hair was COVID-19 positive. These 2 guys didn't get COVID, but they were in close contact. They were wearing their mask when they got the haircut. But nonetheless, they have to do protocol over 5 days, take the test, and if they're okay by Friday, they get to play on Sunday. So there you go. That's kind of thing. And again, safety. Safety is the biggest thing. We mentioned it. You have an opportunity to have a really good time with your friends, make some good memories, but stay safe. What we don't want to happen is to have a super spreader or just a spike. They call it a Super Bowl bump. Okay, so whenever possible, less than 10 people. Here in Hawaii, the game starts approximately 1:30 in the afternoon. Have it outside, weather permitting, of course. But whenever you're going to have it, that's the idea. And what do we say all the time? Wear that mask whenever possible. Obviously, you can't wear it when you're eating. Social distance, and then sanitize. Sanitize a lot. But they're also talking about food. What do you guys usually have when you have your Super Bowl party, Micah?
I mean, you name it, man. Anything from poke, barbecue meats, steak. Sometimes, one time, we even had lobster. I mean, it can get out of hand, really.
So, and traditionally, you would have everybody gets their plate and goes to the line and put it all in there. Well, this year, officials are recommending that you have individual plates. You already have a serving. One person handles all the food, but you have a can of Coke or whatever it may be. Utensils, disposable utensils, the paper plates. Use it and then lose it. Get rid of it. So again, those are some of the main aspects of it. But again, social distancing whenever possible. But the really big thing is try not to have a party with people that have not been in your immediate circle for a long, long time.
Mm-hmm. Now, J.E., I know on the ground in Tampa Bay, things look different for Super Bowl 55, unlike any other time. Can you tell us what people can expect in Tampa this weekend?
Well, traditionally, it's a 100,000-seat stadium. Only 25,000 are going to be let in. Of those 25,000, most of those are going to be recently vaccinated frontline workers who got free tickets as a thank you from the NFL. All the other individuals have to do the appropriate temperature testing. If you look sick, they're not going to let you in. If you don't have a mask, they're not going to let you in. So many different aspects of it of continuing to be cautious. Better to be safe than to be sorry. You don't want to have this, wow, when did they get COVID-19? It was just after the Super Bowl.
Right, absolutely. Jay Orozco giving us everything you need to know and more on Super Bowl 55. Before I let you go, J.E., who are you going for this weekend?
Well, thank you very much for asking, Micah. That is one Thomas Brady.
Okay.
I have tremendous respect for him, seeing him, what he does, and hearing some of the different stories that he brings, that aspect of, hey, we can do it. It's going to happen this year. Wow. And statistic-wise, 6 out of the last 7, when they meet in the regular season, they get beat in the postseason, and Tampa Bay looks pretty good in my eyes. What about you, Micah?
Well, for me, it's historical. I'm going for the home team, right? First time ever the home team has ever hosted a Super Bowl. I like that odds. It looks good. I'm going for the home team. So there you have it.
Well, a happy Super Bowl celebration to you and your family.
Thank you so much, J.E. Safe weekend to you. That'll do it for this week's episode of COVID-19 Talk Story on Naleo TV. I'm Mike Alameda. Until next week, aloha.
The preceding program was a production of Naleo TV.